Hi everybody, welcome to the news from the ANU Medical School, which will now run monthly as a video, and these news are from today, the 18th of March 2021. Now, I'm making the assumption that most of you would have attended Professor Grun's town hall yesterday, where he gave us some background on the change proposal for the college. The document is available to all. And what we are hoping is that you will all read the document in detail and have a think about what that means for you and for us as a school. The college and the organisational change management group at ANU are looking for feedback. The feedback is due in 2 weeks and is to be sent to org.change@anu.edu.au. It is a lengthy document and there will be lots and lots of questions. For this reason, Professor Grun will hold a school town hall probably tomorrow on Friday. I will possibly have a school meeting next week, but there will also be daily drop-ins available for you to meet with me, either as a one-on-one, in person, via Zoom, or in small groups, so I can help and try to answer some questions. So there's a lengthy document. Please read it carefully. We are looking forward to hearing your feedback. We're also trying to coordinate feedback from you so that we have a stronger response, because we're looking for constructive feedback for the future for the college. You may have also seen my email. There are several public locations in Brisbane, Queensland, that have now been listed as COVID-19 exposure sites. And these are the Brisbane City LGA, Ipswich City, Logan City, Moreton Bay and Redlands City. In addition, there are some areas in New South Wales that may require you to get tested if you've been there at certain dates and during certain times. Please check the ACT, New South Wales, Queensland and of course the ANU COVID-19 websites. In spite of COVID-19, we were able to hold graduation for our graduating class from last year face-to-face at the Arboretum, and what a great event it was. I don't think we've shown a picture yet. These are the students, or doctors rather now, during that event at the Arboretum, and I'd just like to express my congratulations to them all again, and we very much look forward to this year's cohort to graduate at the end of the year. On the teaching side, the teaching remains interactive, but as a hybrid model in different locations. The room capacity has changed somewhat. We can now have a person per 2 square meters, not per 4 square meters as before, which means for the small group teaching, we can do this with more students in the room. However, the large group teaching, so that's the lectures, will remain online because we do not have the capacity to offer a seat in either of the auditoriums for all the students. So that's for year 3 and 4, particularly here at Canberra Hospital campus. I would also like to remind everybody that although lectures are on Zoom, there is some good behaviour expected. And if you can turn your camera on, that's particularly for students, please do so. It makes our teaching a bit easier, and we'd just like to engage you. You would have also seen my email that the year 3 and 4 students are now able to get the COVID-19 vaccine. Details in my email. You just have to book on the phone number that's given. Please, if you get a certificate, upload it to Sonia so that we can keep track of that. The vaccination is not mandatory, but we need to know if you have been immunised or not for future placements should there be a COVID outbreak in the ACT. And on International Women's Day, we launched the Gender Equity and Diversity Committee of the medical school. This is a committee that will focus on the prevention of harassment, bullying, discrimination for its students, and is led by Associate Professor Dipti Taolika. The committee is an important addition to the school's Respectful Environments for Adult Learning and Medicine strategy that is also there to prevent unacceptable behaviour. This is a strategy that's been running since 2016 under the leadership of the then Dean, Professor Mitchell. There will be expressions of interest coming out very soon for membership on this committee, so just keep an eye out on that, and you can of course put yourself forward for that. We've also updated the bullying and harassment booklet, and that will be available on the intranet very soon. You may have seen from Professor Gruen's blogs that an MOU has been signed with Calvary Healthcare National, so the little company of Mary. And this offers opportunities for placements, but also for research and other partnerships in aged care, dementia, end-of-life care, and home care services, either in quality safety, interventions, or in research. In addition, we're working on the agreement with the Sydney Adventist Healthcare for student placements, but also for research. And it is quite likely that there'll be voluntary student placements available later in the year. The Sydney Adventist Hospital had some university employees that we have taken over at the college that will help our professional staff in organising the teaching. We are currently working, led by Nick Taylor, the Phase 2 Associate Dean, through the learning outcomes and portfolios, and need to inform our SAN colleagues about this before we can send students there. And when we know a bit more, we will let you know. Now, on the 4th of March, there was a picnic debate held on the lawns of the law school. And this picnic debate around women in leadership was led by Donelle Claudianos, the manager of the college, and Professor Lyndall Stratzens, who's the director of RSPH, Rose Clifford, who's a PhD researcher at RSP, Azur Hermes, who's a deputy director of the National Centre for Indigenous Genomics from John Curtin, and our own Lillian Smythe were debating what differences there are between male and female leadership. And not surprisingly, issues such as vulnerability, compassion, but also neutrality and decisiveness were discussed. And I'd like to, just via the video, welcome the Deputy Director for this year, Associate Professor Alex Webb, to the team. You'll know Alex probably very well. She's got ample expertise in education. And Alex will work as my deputy and particularly help with Phase 1 and Phase 2 education. Of course, Associate Professor David Kramer in his role as the MEU head. She will chair the Medical Education Committee and the Operation Graduate Education Challenge Committee. Welcome again, Alex. We're very happy to have you on board. And during the last promotions round, I'd like to congratulate the following colleagues to promotion. Promotion to Clinical Senior Lecturer was Dr. Yara Kanjanapan, and to Clinical Associate Professor, Dr. Carolyn Hawkins, Dr. James de Rosario, and Dr. Nicholas Coatsworth. Congratulations to all. In terms of events, the Imperfect Bodies of Research art exhibit is still on and will run until the 9th of April. Those exhibits are to be seen at the ground floor of the law building and are a collection of artwork from female identifying academics. Drop in and have a look. It's fantastic what the colleagues all have produced, and looks just wonderful. And I must say, much to my surprise, when I went to my local coffee shop the other day and while I was waiting for the coffee, browsing through the Canberra Times, I would see our own Dr. Carolyn Luke smiling back at me from the front page. Carolyn and her friends were on the front page of the Canberra Times in swimming costumes, celebrating a long history of swimming pools and swimming costumes. If you can get a copy, just have a look at these wonderful way that women used to dress when they went swimming. That's all from me for this week. Please remember to check the COVID-19 websites. I will try to update you as quickly as I can if anything changes. And if you have any concerns around that, please email us. But I think it is important, particularly during these difficult times with the change plan coming out as well, to remember that it is important to look after yourself, but also to look after your colleagues, because we'll work together. We are a team, and we need to keep each other grounded, and we need to continue to work to each other and be supportive. I'll see you on this channel again in a month. Thank you. Bye-bye.